Assessing the head, eyes, ears, neck, nose and throat. Initial assessment. 1. Identify the patient, ensures accuracy of assessment, and establishes trust. 2. Explain the purpose of the head and neck examination, and answer any questions, promotes informed consent, reduces anxiety, and allows for clarification of concerns. Aligns with communication and patient autonomy principles. 3. Perform hand hygiene, prevents the spread of infection, and adheres to infection control protocols, protecting both the patient and healthcare provider. Assessing the head and neck comprise of head to eyes _ 1. Inspect the head and then the face for color, symmetry, lesions, and distribution of facial hair. Note facial expression. Palpate the skull. Asterisk detects abnormalities in shape, size, color, symmetry, lesions, and hair distribution. May indicate neurological issues, trauma, skin conditions, or infections. Asterisk facial expression assessment can reveal neurological issues, pain, or emotional state. Asterisk skull palpation detects tenderness, lumps, or depressions potentially indicating fractures or other issues. 2. Inspect the external eye structures eyelids, eyelashes, eyeball and eyebrows cornea, conjunctiva and sclera. Note color, edema, symmetry and alignment. Asterisk detects redness, watering, discharge, eyelid abnormalities, and visual alignment. May indicate infections, allergies, or injuries. 3. Examine the pupils for equality of size. Reaction to light by darkening the room and using a pen light to shine the light on each pupil. Asterisk assesses pupillary light reflex. Important for neurological function and potential brain injuries. 4. To test for pupillary accommodation and convergence. Ask the patient to focus on an object as you bring it closer to the nose. Asterisk evaluates cranial nerve function and potential neurological issues. 5. Using an ophthalmoscope, check the red reflex. Asterisk visualizes internal eye structures, identifying abnormalities like retinal detachment, cataracts, or optic nerve damage. 6. Test the patient's visual acuity with a Snellen chart. Ask the patient to read the smallest possible line of letters, first with both eyes and then with one eye at a time. Asterisk determines sharpness of vision and potential need for corrective measures. 7. With the patient about to feed away. Ask the patient to focus on your finger and move the patient's eyes through the 6 cardinal positions of gaze. Asterisk evaluates cranial nerve function and potential neurological issues. Assessing the ears. 1. Inspect the external ear bilaterally for shape, size and lesions. Palpate the ear and mastoid process. Asterisk rationale detects abnormalities in shape, size, lesions, tenderness, or swelling that may indicate asterisk infections otitis externa, media, mastoiditis asterisk skin conditions eczema, psoriasis asterisk trauma lacerations, hematomas asterisk tumors asterisk nursing principle, aligns with holistic assessment and abnormality detection for early identification of potential ear problems. 2. Perform an otoscopic examination. For an adult, pull the auricle up and back. For a child, pull the auricle down and back. Note cerumen, edema. Discharges or foreign bodies and condition of the tympanic membrane. Asterisk rationale. Visualizes the ear canal and tympanic membrane to detect. Asterisk cerumen impaction, wax buildup. Asterisk foreign bodies. Asterisk otitis media. Middle ear infection. Asterisk perforations of the tympanic membrane. Asterisk cholesteatoma, skin growth in the middle ear. Asterisk nursing principle. Employs specialized skills for comprehensive assessment, aiding in accurate diagnosis and timely interventions. 3. Use a whispered voice to test hearing. Stand about 1 to 2 feet away from the patient, out of her line of vision. Ask the patient to cover the ear not being tested. Perform tests on each other. Asterisk rationale. Quickly assesses for unilateral hearing deficits that may indicate asterisk conductive hearing loss, ear canal, or middle ear issues. Asterisk sensory neural hearing loss, inner ear, or nerve damage. Asterisk nursing principle. Implements basic screening to promote early detection of potential hearing loss and its underlying causes. 4. Use the tuning fork to perform Weber's test and Rin's test if the patient reports diminished hearing in either ear. Asterisk rationale. Differentiates between conductive and sensory neural hearing loss based on sound lateralization perception. Asterisk Weber's test. Identifies if sound lateralizes to the affected or unaffected ear. Asterisk Rin's test. Compares air and bone conduction sound perception. Asterisk nursing principle. Utilizes specific tests for further assessment and localization of hearing loss, guiding appropriate referrals and management strategies. Assessing the nose. 1. Inspect and palpate the external nose. Asterisk rationale. Detects abnormalities in shape, size, lesions, redness, tenderness, or swelling that may indicate asterisk infections, rhinitis, sinusitis, asterisk allergies, asterisk trauma, fractures, lacerations, asterisk skin conditions, eczema. Rosacea. Asterisk nursing principle. Aligns with holistic assessment and abnormality detection for early identification of potential nasal problems. 2. Palpate lightly, percuss over the frontal and maxillary sinuses. Asterisk rationale. Assesses for sinus tenderness or pain suggestive of sinusitis and inflammation of the sinuses. Asterisk nursing principle. Employs palpation and percussion techniques to evaluate potential sinus involvement in upper respiratory complaints. 3. Occlude one nostril externally with a finger. While patient breathes through the other, repeat for the other side. Asterisk rationale. Quickly assesses for nasal patency airflow through each nostril, identifying potential blockages caused by asterisk deviated septum, asterisk foreign bodies, asterisk nasal polyps, asterisk tumors. Asterisk nursing principle. Implements a simple screening test to promote early detection of nasal obstructions and their underlying causes. 4. Inspect the internal nostrils using an otoscope with a nasal speculum attachment. Asterisk rationale. Visualizes the internal nasal structures to detect asterisk mucosal abnormalities, redness, edema, discharge, asterisk septum deviation, asterisk foreign bodies, asterisk structural abnormalities. Asterisk nursing principle. Utilizes specialized equipment and skills for comprehensive assessment, aiding in accurate diagnosis and management of internal nasal issues. Assessing the mouth. 1. Palpate the temporomandibular joint. By placing your index finger over the front of each ear as you ask the patient to open and close the mouth. Rationale. Assessing the TMJ for tenderness or clicking during jaw movement, identifies potential temporomandibular disorders, TMD. TMD can cause pain, limited jaw movement, headaches, and difficulty chewing. Early detection and management are crucial to prevent complications and improve patient comfort. 2. Perform hand hygiene and gloves. Inspect the lips, oral mucosa, hard and soft palate, gingivae, teeth, and salivary gland opening by asking the patient to open the mouth wide using a tongue blade and penlight. Rationale. Maintaining hand hygiene and wearing gloves reduces the risk of infection transmission during close contact with the oral cavity. Examining the following structures helps identify potential oral health issues. Asterisk lips, dehydration, infections, allergies, or nutritional deficiencies can manifest as chapped lips, lesions, or abnormal color. Asterisk oral mucosa, redness, inflammation, ulcerations, or patches can indicate infections, oral lichen planus, or systemic conditions. Asterisk hard and soft palate, abnormalities in appearance or texture could suggest infections, trauma, or tumors. Asterisk gingiva gums, swelling, bleeding, receding gums, or pockets are potential signs of gingivitis, periodontitis, or other gum diseases. Asterisk teeth, cavities, wear and tear, discoloration, or missing teeth require dental evaluation and treatment. Asterisk salivary gland openings, swelling, dryness, or discharge might indicate salivary gland dysfunction or infections. 3. Inspect the tongue. Ask the patient to stick out the tongue. Place the tongue blade at the side of the tongue, while the patient pushes it to the left and right with the tongue. Inspect the uvula by asking the patient to say ah while sticking out the tongue. Palpate the tongue for muscle tone and tenderness. Remove gloves. Rationale: observing the tongue's color, texture, and movement provides valuable information about overall health. Asterisk movement. Difficulty extending the tongue or tremors could indicate neurological issues like stroke or Parkinson's disease. Asterisk tongue coating, color and thickness can suggest dehydration, nutritional deficiencies, or certain medical conditions. Asterisk muscle tone, palpating the tongue assesses its strength and consistency, potentially revealing neuromuscular disorders or vitamin deficiencies. Asterisk uvula, asking the patient to say ah allows for visualization of the uvula, checking for symmetry and movement, which can be affected by neurological conditions. Assessing the posterior neck. 1. Palpate the forehead to the posterior triangle of the neck and the posterior cervical lymph nodes using the finger pads in a slow circular motion. Rationale: this step aims to detect enlarged or tender lymph nodes, which may indicate asterisk infections, bacterial, viral, asterisk inflammatory conditions, autoimmune disorders, asterisk tumors, lymphoma, other cancers. Palpation uses slow circular motions with finger pads for sensitive detection. The posterior triangle encompasses lymph nodes near the back of the neck and shoulders. 2. Inspect and palpate in front of and behind the ears, under the chin, and in the anterior triangle for the anterior cervical lymph node. Rationale: similar to step 1. This examines additional lymph node groups located asterisk behind and in front of the ears, parotid, preauricular nodes, asterisk under the chin, submandibular nodes, asterisk along the jawline, anterior cervical nodes. Detecting enlargement or tenderness in these areas can lead to further investigation for underlying causes. 3. Inspect and palpate the left and then the right carotid arteries. Only palpate one carotid artery at a time. Use the bell of the stethoscope to auscultate the arteries. Rationale: this step assesses asterisk carotid artery pulsation. Weak or absent pulsation in one artery might indicate narrowing or blockage. Asterisk brute swishing sounds. These can suggest turbulent blood flow due to narrowing or atherosclerosis. Palpation is done with one hand at a time, while auscultation uses the stethoscope bell over each artery, listening for irregularities. Early detection of carotid artery issues is crucial for preventing stroke. Assessing the anterior neck. 1. Inspect and palpate the trachea. Rationale: this step detects any deviations in the trachea's position, tracheal deviation, which can be caused by asterisk masses or tumors in the chest or neck. Asterisk enlarged thyroid gland, asterisk aortic aneurysm. Palpation assesses for tenderness or instability, potentially indicating underlying issues. 2. Palpate the thyroid gland. Then, if enlarged, auscultate the thyroid gland using the bell of the stethoscope to auscultate the arteries. Rationale: this step aims to identify thyroid abnormalities. Asterisk enlargement, goiter, suggests hyperthyroidism, hypothyroidism, or thyroid nodules. Asterisk tenderness can indicate thyroiditis, inflammation. Auscultation with a stethoscope bell over an enlarged thyroid listens for brute swishing sounds, suggesting hyperthyroidism. 3. Inspect and palpate the supraclavicular area. Rationale: this area, above the collarbone, harbors lymph nodes. Detecting enlarged or tender supraclavicular lymph nodes may indicate Infections. Upper respiratory, thoracic cancers, lung, lymphoma. 4. Inspect the ability of the patient to move his neck. Ask the patient to touch his chin to chest and to each shoulder. Each ear to the corresponding shoulder, and then tip head back as far as possible. Rationale. This assesses range of motion and flexibility in the neck, potentially revealing pain can be caused by muscle strain, arthritis, or nerve impingement. Stiffness may indicate underlying conditions like cervical spondylosis or fibromyalgia. Observing the ability to touch chin to chest, shoulder to ear, and head tilt helps identify limitations and potential causes. After the procedure. 1. Perform hand hygiene. Rationale. This prevents the spread of infection. After patient contact. Infection control. During a head and neck examination. Nurses come into close contact with various body fluids and surfaces that may harbor pathogens. Performing hand hygiene with soap and water, or an alcohol-based hand rub immediately after the examination is crucial to prevent the spread of bacteria, Staphylococcus aureus MRSA, Streptococcus pyogenes, Pseudomonas aeruginosa viruses, influenza, herpes simplex virus, hand, foot, and mouth disease fungi, Candida albicans. Protecting patients, patients undergoing head and neck examinations might have compromised immune systems due to illness, treatment, or age. Implementing strict hand hygiene practices minimizes the risk of transmitting healthcare-associated infections to them, which can have serious consequences. Protecting healthcare workers. Nurses are frequently exposed to various pathogens throughout their workday. Regular hand hygiene helps safeguard their own health and well-being, reducing the risk of contracting infections and spreading them to their families and communities. Maintaining professional standards. Hand hygiene is a cornerstone of infection control protocols and a fundamental responsibility of healthcare professionals. Adherence to these standards demonstrates professionalism and commitment to patient safety. Beyond the rationale. Hand hygiene goes beyond simply following protocols. It's an act of care and respect for both patients and healthcare providers. It creates a safer environment for everyone involved in the healthcare setting. Remember, hand hygiene is a simple yet powerful intervention that plays a vital role in preventing the spread of infection and promoting patient safety. It's an essential element of every head and neck examination and a cornerstone of responsible nursing practice. 2. Document the findings of the assessment rationale. This ensures accurate and complete medical records for continuity of care and communication between healthcare providers. Monitoring changes over time and identifying trends. Providing information for diagnosis, treatment planning, and follow-up. Thank you for watching and for your kind attention.